Good afternoon, everyone. Shall I start?
Yeah, you can start.
Good afternoon, everyone. I, Dr. Ishwarya, PG Scholar from GHMC, heartily welcome you all to the third day of 6-day free webinar series on Bright Talks by Eminent Homeopaths, organized by Government Homeopathic Medical College, Bhopal, in collaboration with Homeopathic 360. So before I begin, I would like to express my gratitude towards all our esteemed speakers, coordinators, moderators, and our audience. Also, I would like to acknowledge Sri Ram Kishore Kanware, Honorable Minister of Ayush Government of MP, and Dr. M.K. Agarwal, Secretary Commissioner of Directorate MP. Also, I would like to thank respected Principal Sir Dr. S.K. Mishra and Mr. Manish Jain, the Director of B. Jain Publisher, for providing us this opportunity. So before any delay, I would like to introduce you to our esteemed speakers for today's webinar, Professor Dr. Rajat Chattopadhyay, Principal and Administrator of one of the prestigious college, Calcutta Homeopathic Medical College. And good afternoon, sir. We welcome you.
Good afternoon.
And today's coordinator, Dr. Praveen Jaiswal, sir, Professor and HOD, Department of Practice of Medicine, and Dr. Sanjay Gupta, sir, Professor, Department of Practice of Medicine. Over to you, sir. Sanjay, sir, Dr. Sanjay, sir.
Okay. So I welcome all the participants along with our esteemed speaker, Dr. Rajat Chattopadhyay, sir. I'm happy to introduce him at this event of Practice of Medicine webinar. He has been a PhD qualified homeopath, one of the few homeopaths who have their qualification at a Doctor of Philosophy level. He has completed his PhD from West Bengal University of Health Sciences, one of the reputed university of the country. Besides that, as it has been already told by the coordinator, he is principal and administrator of the Calcutta Homeopathic Medical College and Hospital, Kolkata. And we all must be knowing, and if we are not updated, let us update ourselves. The Calcutta Homeopathic Medical College is the oldest homeopathic institute of Asia. So it is a proud moment to be an administrator and principal of this college. Besides, the sir has the professional experience of 25 years in the homeopathy, and apart from it, out of which 20 years he has spent as a academician teaching homeopathy throughout his career. He has also penned down 3 books. One of them is on cardiology, and B. Jain has supported to publish that book. Besides that, he has been resource person very often and frequently with Central Council of Homeopathy, New Delhi, a statutory body, and Central Council for Research in Homeopathy, National Institute of Homeopathy at Kolkata. Besides, he has many publications in peer-reviewed journal, and he has worked as head of the department Practice of Medicine for 12 years before achieving this position. He has been presenting papers internationally and nationally at various occasions, and he has been working as a research scholar as principal investigator in number of research projects which have been funded by the state government or at national level. I welcome you, sir, on behalf of our Government Homeopathy Medical College team, and I now hand over the mic to you so that we can be enlightened by your paper. Over to you, sir, Rajat sir.
Should I start? Okay. Thank you all. First of all, I should convey my thanks to Government Homeopathic Medical College, Bhopal, all the esteemed staff, including respected principal Sir, HOD Medicine, Dr. Pravin, Dr. Sanjay ji, and all other members of the esteemed college, Bhopal Government Homeopathic Medical College and Hospital. I, I should also convey my thanks to Homeopathy 360 and BJN Group to make this wonderful opportunity, to provide us the wonderful opportunity during this pandemic situation to go to the series of webinars, and lots of webinars, lots of we can enrich ourselves through these webinars of different stalwarts of homeopathy in India and abroad. Today's topic, we have decided, the integrative clinical medicine and homeopathy, because this part, the integration part, it is very, I can say, this is a misnomer term, and also this term, the misunderstood maybe in very many occasions, and also it differs from man to man, from profession to profession. Whatever integrative concept in the first year, in the second year, in the preclinical subjects in homeopathic, not only homeopathic, in any medical education, that the same thing may not be there. Same thing may not be there in the clinical subjects. I am audible now. My mic is functioning well.
Yeah, sir.
Yes, sir.
Okay. Thank you. So the concept of integration, the concept of integrative medicine or integrated medicine, just little differences there between one is regarding to the person, to the professional, and another to the applied part of that, the integration and the integrative. But the understanding of the integration in modern medicine, understanding of the integration in homeopathy, understanding of integration even within the homeopathy in different, not only within the homeopathy, also within modern medicine, it differs from year to year, from preclinical level to clinical level, even after clinical level in the clinical field. So the concept of integration, even in the policy level, government policy level, concept of integration, if you just say right now, if this seminar is going on in US or USA, then the concept of integration is there with the conventional medicine, and including all types of clinical, all types of therapeutic approach, including acupuncture, Ayush system, all other systems, including physiotherapies. These are their concept. But also integration in our homeopathy, it differs. So we should explain it one after another. So what you mean by integrative medicine? First few slides here, we shall make a detailed discussion on the, you can say, the dissection we can make of the concept of integrative medicine. So integrative medicine is an approach to care that puts the patient at the center and addresses the full range of physical, emotional, mental, social, spiritual, and environmental influences that affect a person's health. You can remember the definition of WHO, World Health Organization. Even this is more than that. Physical, emotional and mental. You can remember the concept of our mind, the division of the mind in homeopathic philosophy. Even when within the mind there is will, understanding, intellect, and the emotion part is added by our Dr. Vitulkas and very many experts. So physical, emotional, mental, even social, spiritual, environmental influences, even maybe more addition within this, that affect a person's health. So it is very important. The concept of integrative medicine itself stimulates with our concept of homeopathic philosophy. So integrative medicine plays an important role in improving healthcare in that it uses the best of all modalities to achieve wellness and health that is safe, effective, patient-centered. That's why it is in red, it is in bold, efficient, equitable, and accessible. The most interesting part of that, this integrative medicine, what is integrative medicine, what is the definition, how one should go approach to this integrative medicine, these are all mostly made by the USA or US authorities. You know that in clinical medicine, our most important authorities are like Harrison from USA, if it is from Davidson, it is from UK. So It differs. It differs. The same thing, all these definitions, all these concepts, it is as per their philosophy, and as per their philosophy, they are now concerned about the patient centered. So they have not uh, focused on only disease, on only pathology. So now at least they have learned, or at least they have, I can say, I can't say they have influenced by our pathy, but at least being a homeopath, we can feel superior that our philosophy is the same thing what they are now achieving. They are now want to tell, want to explain the same thing which is already known to every homeopath. So patient-centered thing, it is very important. Also, I very many times I tell in all the clinical medicines book, in all the practice of medicine books, if you go through right now in the introductory part, in most of the book, it started from Oxford Clinical Medicine short one, the short book of concise book of Oxford Medicine, but now you can get it in many other good books of clinical medicine where it is stated that please treat the patient, not the disease. But never acknowledged homeopathy or never acknowledged our master Dr. Hahnemann, but at least they have written this thing in their book. So it is, we can feel superior, we can have pleasure that already this philosophy is known to us, and on the basis of that homeopathy stands. So, integrative medicine emphasizes the therapeutic relationship and makes use of all appropriate therapies, both conventional and alternative. So, conventional means the modern medicine, they are in their language. So, integrative medicine is definitely holistic. In which form of holistic? Because it includes everything, the conventional and alternative, all types. It uses a conventional medicine toolbox, it uses a non-conventional medicine toolbox, including homeopathy. Not only homeopathy, everything, all the Ayush, acupuncture, etc., everything. So, in this perspective, they are talking the holistic concept of integrative medicine. But this is not our view. The homeopathic view is not as per their concept of integrative medicine. It differs. I will come later. Again, integrative medicine different from other practices because the emphasis is on the cause rather than an immediate diagnosis. So, what should your interpretation? The cause, the emphasis on the cause, it is the basic thing of modern medicine. So, why it is telling that integrative medicine different from other practice? Because they are not only concerned about the cause, about the materialistic cause, that is the bacteria or virus or anything. They are concerning about the causes which can, the multifactorial causes from the environment, from the anything. So they are not only confined their search into bacteria or into viruses or into the materialistic causes. That's why it is something different. Integrative medicine looks at how and what, but functional medicine also asks why. So it is not confined with how and what, because it is the modus operandi, how it was happened and what happened. So this is, you can see the effect, what has happened and how it has happened, that is the modus operandi. But why it has happened, why you have identified one autoimmune marker in your body when you are going well, when you are feeling well, you have no problem, but you suddenly you appear some symptoms which ultimately indicates you have an autoimmune disease, and you have identified the markers of autoimmune disease. So it is not that what happened that you have identified the markers of autoimmune disease, but it is very important that why it was happened, what is going on within your economy, what is going on within your health. This is very important. So why you have to go to very deep, you have to go to longitudinal as well as cross sectional study. Longitudinal study, you understand, you have to go to depth, and cross sectional study, you have to be within the society. You have to go through all the aspects of the society to know how the disease evolves. So why it evolves, this is very important. Research into the patient's background takes priority. This is important. The patient's background means not only past history. In the past history also it is written the past history should be taken in chronological order. What illness you have, that should be in chronological order. Why it is in chronological order? Because then only you can understand how the disease evolved one after another, one after another. It should not be haphazard. So the patient's background it taking priority, and it includes an analysis of their genetic makeup also. I am talking about genetic makeup. So genetic makeup, it is not only that something new, because whenever we talk about constitution, whenever we talk about diathesis, whenever we talk about tendencies, whenever we talk about susceptibilities, these are all these are all covered under the genetic makeup. Now, even the miasmatic dyscrasias, the pathological tendencies, these are all. So we are genetically susceptible. We are genetically vulnerable to develop this type of disease. Nowadays, we can tell the genetic, we can tell the name of gene. Even that nowadays, we have gone more than that gene. We have gone through the epigenetic network. It is beyond the genetic level. So, but when it was homeopathy was invented by our master, at that time, no genetic concept, nothing the individualistic concept. So if you think from that perspective, it was genius more than 200 years ago, even the 1810 of your organon of medicine first edition, 210 years back, 1805 and 1806 of medicine of experience, even the 1792 and 1796 of friends of health, first part and second part, unique one. I just wonder that all the advisory given at the 92 and 96 at that time in the Friends of Health, the same thing in the form of our uh, social distancing, physical distancing, keeping the sanitization, all the hygiene to maintain the hygiene. These are all things now it is happening in this era, and which is already written about the isolation, about the surveillance, about the quarantine, everything is written. You just open the pages. It may be in something in the old language, in something in old English, but the essence of the writings, essence of the articles of Friend of Health is nothing, it's a similar thing which is going on told by World Health Organization time to time as advisory. So integrative medicine recognizes all of the potential influence on one's health, how the health is influenced, impaction of the society, impaction of the environment, everything on one's health. It is the study of the human ecology that includes the physical and non-physical factors. It is always not only the materialistic, it is also metaphysical. It is also beyond the materialistic concept, the dynamic pathology, non-physical factors of how humans interact with their environment. Since long, it was told by the internal milieu, the Claude Bernard. You can remember the internal milieu, external milieu, our homeostasis, the adaptation. These are all things. So, how human interact with the environment is very important. Care is applied through these relationships that provide insight into each individual's unique situation and needs. You will agree that all human beings have their unique situation and needs, depending on their family, depending on their genetic background, depending on their society, depending on others' perspective, even the political, economical, all the factors in the society, it matters. It matters to develop your personality, to develop your reaction. It is not very easy. It is easily, we can say that what is susceptibility? It is the reaction of our body to the environmental influences. But these type of reaction also can be influenced by very many factors. That's why multifactorial factors you have to consider whenever you are taking a case of chronic disease. And if this is up to, even you have to go through the genetic level, beyond the genetic level. These are very important ones. So you can see here everything is there: ecology, zoology, economics, international studies, finance, climate change, physics and engineering, environmental science, chemistry, political science, public policy, plant biology, everything. If the policymakers is something decided just to implement, and you are getting impacted from those, just the notebandi, just the currency changes, just the concept of this lockdown, just the unlock phases, everything which whatever is going on in the society, it has got different type of impact on different sectors of the society. It may not have impact on your health, but the same thing may have the impact on others' health. So their reaction will differ from your reaction. So it is the multifactorial events, and you have to consider during taking the case. We must be one like Sherlock Holmes. You know the Sherlock Holmes, the your intellect, your inquisitiveness, your tactfulness, whatever written as a knowledge of physician, everything requires, even more than that. So it is your uniqueness. How can you depict the real case taking part, the real totality, the portrait of the disease from these angles? So if you have no idea about your society, if you have no idea even your politics, what is going on in the scenario, in Indian scenario, even in international scenario, what is going on, how can you judge one patient who is dynamically ill? His pathology is a dynamic pathology. So whenever you have to understand the disease, you have to consider the dynamic concept. This is very important one. So integrative medicine involves using the best possible treatments from both complementary CM, complementary and alternative medicine, and allopathic medicine. The same thing in the previous slides, based on the patient's individual needs and condition. This selection should be based on good science and neither rejects conventional medicine nor uncritically accepts alternative practices. This is a very important one, that this selection should be based on good science. It neither rejects conventional medicine. You can't reject everything of conventional medicine, just like the criticism of 1 to 99 first introduction of organon. Hahnemann vehemently criticized everything, but he criticized everything with his rationality, with his ideology, and with the example and references. So you can't reject everything. What is the truth in the conventional medicine? Even it should be appreciated that all the drugs, whichever new drugs is coming in the modern medicine, conventional medicine, the side effect of all those drugs, the bad effect of all those drugs, all those things narrated by the conventional medicine people only. It is not that homeopaths or Ayush people or any other people just made research and told about you the bad effects of conventional medicine. So these are their continuous inquisitiveness, their continuous research, R&D. These are the very good factors in the conventional medicine. Even in the acute stage, even in the emergency condition, even the innovative techniques in the biomedical engineering, these are the very wonderful things which we should accept in medicine. But nor uncritically accepts alternative practices also. Whatever is going on as per Hahnemannian principle, if anyone is doing anything contrary to Hahnemannian principle, but he is claiming that as a homeopath, he is doing homeopathy, so he has to establish in the language of science. He has to establish it in the through the research orientation, because only 1 or 2 or 3 separate cases, and can't claim anything that you have cured and whatever you have done through the contrary of the homeopathic principle. So if you do it, then you make it rational. Whatever you may go through the contrary of homeopathic philosophy. You may invent something new, which is not at par homeopathic philosophy. But then you establish it with your justification, with your rationality. You just establish it with the research aptitude. Then only it can be accepted as a form of alternative medicine, not only in homeopathy, in other factors also. So it integrates successes from both worlds, and both worlds means conventional medicine and the alternative medicine, and is tailored. It is tailored to the patient's needs using the safest, least invasive, most cost-effective approach, while incorporating a holistic understanding of the individual. Nowadays, what people want safe drug. People want gentle drug. People want something more to the natural. People want, one should learn my complaint. The patient, I am talking about people as patient. So all these things can be, it is a very better opportunity for homeopaths, even in the Ayush system, in Ayurveda also. Their concept also more or less totally holistic. Even the concept of Ayurveda is very much similar with the concept of homeopathy in very many instances. Like we have psoriasis, psychosis type of miasmatic dysplasias, they have biopitta cough type of tendencies of the patients of the suffering. So in these aspects, even the natural aspect, though the applications of the Ayurveda and applications of the homeopathy differs, but the essence, the philosophy of the pathy, it is very much similar. So the patient's demand, whatever the patient is wanting, that is very much close to Ayush system. So it is a unique opportunity to us to show our rationality, so our justification why the patient should take only homeopathic or Ayush system of medicine. The major goal of scientific integrative medicine is to treat effectively or prevent diseases before they become symptomatic. This is the another aspect. Because nowadays, I think most of the funding in the research is billions of funding in the researches all over the world is going on the preventive aspect. So even the modern medicine, conventional medicine, now they are shifting away from the concept of antibiotics to kill the bacteria. They are now thinking of concept in the preventive concept of molecules through which the bacteria, virus, or anything with the path of chain action, whatever that can be blocked early. That is the preventive pathway. The molecules, even they are thinking of single medicine. They are thinking of the prescribing. There is the single molecules drug. These are the thinkings is going on, which is just for the prevent disease very early, because it is that prevention is better than cure, and if you prevent it very early, then the monetary you have the monetary advantages also in a big extent. So beyond practices that promote health in general, such as regular exercise, dietary moderation, refreshing sleep, the rapidly expanding availability of genetic, physiological, and biochemical information, these are mainly through Ayush systems, mainly through these alternative systems, mainly through these our holistic concept, enables prevention of allostatic load. This is the concept. What is allostatic load? That is the uh, peculiar type of derangement, the dynamic pathology in one's economy due to huge amount of stress. You can say allostatic load. So whatever is going on right now, it is the era of corporative era. We are going to the corporative governance, and you have to earn money. You can see in all the developed countries, privatization is the main theme of their development. So India as a developing country, they are now also from the agricultural level, we are now going to the industrial level, and the e-corporate e-governance is very much in progress. So in this perspective, also our Indian economy also thinking of all these type of things for which our people they have to adapt with this. Now the corporate governance is not similar to government governance. Government governance security is too much there, security is there, but the pace of the work is very slow in comparison to the corporate governance. In the corporate side, they are running always running behind the target. The target is fixed, and target is not only fixed, target is time to time changed. It is within the month, it may be within a month, it may be within year. So you have to achieve the target, otherwise you will be financially ruined. So we have to run, we have to achieve our goal, we have to achieve our target within a stipulated period of time given by your corporate governance. So these type of all the things, these even not only in offices or in corporate level sectors, in the schools, you can see it now. Schooling it begins in 2+, 3 and 2+ level. Beyond the nursery, even 2 years before the nursery level, it not starts from the year 6 years of age. So from the very beginning, we are running behind our achievement. Behind even being a pregnant woman, she is thinking the calculative pregnancy is going on, because she has to resume her duty after that, and how the calculation is going on. So these type of thinking can accumulate stress, which is you can say the allostatic load, and timely institution of effective treatment that are specific for the individual. Now, if you say there are so many things, disadvantages we are facing, even so many deaths of our medical profession, so many esteemed doctors, our respected seniors, even our colleagues, even the juniors, so many things, devastation is going on all over the world, so many deaths, so many fear, everything is locked down. But if I say that it's a very good thing, one thing happened due to this, human being all over the world just learn to stop some while within the running. The we are these within this globalization aspect, everything we were looking the positive things of globalization, but we have to remember the negative things of the globalization, what is affect, as because now this become pandemic just due to this globalization. So these are the cards of civilization. In one part we may go to very high, but in another part we have to sacrifice. So we have to understand, probably we forget everything. we are running only behind our goals, behind the flame, behind the money, behind the everything. But something, this pandemic, remember us that this is the situation. So we have to stop a while. Now the human being, this generation, now learn to stop at a time. So for integrative medicine to provide effective personalized medicinal solutions, this is the concept right now is going on, the personalized medicine solutions. For one, it is not that everyone will take azithromycin. Everyone will take, anyone may take gram-positive bacteria, antibacterial, antibiotic. Anyone may take the gram-negative type. Anyone may take the different type of antibiotics, the generation-wise difference. So personalized medicine solutions is the very one which is very near to our concept of individualistic concept of homeopathy. So whatever you may say that the personalized medicine concept is maybe our advanced state of our individualistic concept. It little bit different. There is difference between the dynamic and the materialistic concept. But if you think the essence, the crude essence are same. So the medicine will be based on the person's requirement, will be based on the person's individuality. So personalized medicine solutions in cardiovascular patients must take responsibility for their own health and actively provide information due to the patient narrative. I will give example of Chinese medicine. Chinese medicine practitioners have been using the body constitutional theory in diagnosing and personalized treatment strategies for hundreds of years. As a health model, the body constitution theory suggests prevention measures which strengthen the body through normal gender and milestone limitations. It also points out pathological states which can affect any constitution and dietary and lifestyle recommendations during treatment and recovery. So Chinese, if I can refer you one book that is The Turning Point by Fritjof Capra. If you go through, it is available in the India. The Turning Point, all the thing, most of the time, it is just giving reference of the holistic Chinese medicine, which tells about the health, which tells about the holistic health. So how the pure personalized concept that it is not that everyone will take fat and everyone will develop cardiovascular disease and atheromatous plaque and the block in the arteries. It is not like that. But who is susceptible to develop the disease and why? So who will do must the exercise? Who will advise to restrict the cut the dietary restriction to whom we will implement? These can be judged. These can vary beforehand if we have the idea of the constitution of the patients and the environment of the patient. This is very important because if the patient is going through very cool environment without any stress, so there is no chance of allocated stress like what with in the previous slides it was there. So there every chance that patient will not develop any type of cardiovascular disease if the accessory circumstances are not very bad. So these are the concept. It is also in integrative medicine. One new thing, it is just whenever we talk about any concept, so many little terminology are there. Like another terminology, this is called endobiogeny. Endobiogeny is a part of integrative medicine. Here, integrative medicine has played a role in slowly and incrementally, that's why progressive incrementally increasing the possibility of having a dialogue with researchers on expanding the boundaries of scientific inquiry. Very interesting one. Endobiogeny is a fundamental re-examination of the principles of science, philosophy of life, and the use of mathematics to quantify physiology and psychology. It's a very important message in this slide. It's the fundamental re-examination of the principles of science, with science already confined with the Avogadro's laws of 6.023 into 10 to the power 20. With science, which philosophy is believe in Cartesian philosophy. If Cartesian thought is also a part of philosophy, the René Descartes, the Cartesian thought, just to divide the mind and body, even the mind also to divide the understanding, will, understanding, intellect. This is not written by Hahnemann anytime. In this aspect, Dr. Kane differs from Hahnemann. in being a man from Bengal, I can say whatever case taking we made it is not of Hahnemann, we made of Kentian. Because in Calcutta, most of the more than 5-6 students here from Dr. B.K. Bose to N.M. Chaudhary, they directly went to, they are direct student of Dr. Kent. Even one was after that student of Sir John Ware. So what they have learned, that is the Kentian homeopathy, and Kentian, all the Calcuttans type of case taking, and most of the case taking it is not as per Hahnemannian, it is more or less Kentian. So Kentian homeopathy differs from Hahnemannian homeopathy. I should refer you one very wonderful one writings is on this. This is the where Kent differs from Hahnemannian homeopathy by Andres Heine. And there are 2 or 3 another writings also. But you maybe your whatever you will understand, whatever you will perceive, that will be judged by you only. So you judge Hahnemannian concept and Kentian concept. Both are correct in their field, in their circumstances, in their environment. So whatever Hahnemann told, that is a concept of totality. On this totality, you just have to know the practice of medicine, the clinical medicine aspect, and from there, whatever is new, that refers to your individuality, that refers to your genetic concept, that is your PQRS 153, that is your uncommon peculiarity, which is not common to disease pathology. This is a very simple thing, but can differs from this. This presentation is not for this. I in other any presentation, we may concentrate on these only, where Kent differs from Hahnemann or where Hahnemann differs from Kent. This like so, endobiogeny is neither an uncritical embracing of nor movement away from modern principles of scientific inquiry. So it is not that anything you are telling against the allopathy, against the conventional medicine, and we are embracing you because you are talking against the modern medicine. It is not like that. We should have a critical thinking approach. We should have. Because still, that's why research methodology, the research aptitude, we should develop. And within the research aptitude, the critical thinking concept, why it happened, why doctor prescribing always this medicine to this. The PGTs has the right to ask the physicians to know the justifiability of the prescription, to know the cause behind the prescription. That may be his experience. That experience gathered in the 30 years, 20 years, 25 years, but what he experienced, on which basis, all those data should be well known to all, so that after his death, after his retirement, his uniqueness cannot be dumped, cannot be in oblivion, cannot be. That should be shared to the future generations, so that homeopathy can enrich. So this type of scientific inquiry, the ability of the critical thinking, it is very important. So neither it is an uncritical embracing of pre-rational
एक मिनट मुझे ये स्क्रीन लाइव कैसे आएगी? ये अटक गई है.
Endobiogeny seeks to integrate and interrelate physiological phenomena. Is it okay? Is it okay?
Yes, sir, it's okay.
Okay. Endobiogeny seeks to integrate and interrelate physiological phenomena to explain how a complex. This is a very important one. If anyone here is from preclinical subject of anatomy physiology, it's a very wonderful thing. Endobiogeny seeks to integrate and interrelate physiological phenomena to explain how a complex and dynamic system such as a human being can come into existence, develop, and undergo the massive and dramatic changes from infant to adult, adapt to circadian, seasonal, and circannual demands, and manage itself against internal and external aggressions. It offers this rational, deductive, inductive approach, both deductive and inductive approach, in order for physicians to have a more precise understanding of their patients. So endobiogeny is a new concept, but whatever is the philosophy of the endobiogeny, whatever the science behind the endobiogeny, nothing new to our homeopath. Whatever they are talking, that is the all external environmental influences. even our internal anything exaggerations may cause the disease, may cause something disturbance in our economy. And with all the, the circadian rhythms, everything, all the accessory circumstances we are well aware of, everything can cause change in humans' economy that a physician should take care of whenever, even the patient, the high blood pressure, even the high uric acid, even the little bit of creatinine level high, even blood sugar level high, maybe within the physiological limit of that patient. At that time, no medicine may be required, because only lifestyle modification may bring the changes into his endobiogeny, into his economy, and he may not require any medicine. But by giving medicine, you are responsible for making iatrogenic disease, or the dependency from the, you are inducing dependency on the medicine, which is a criminal offense. And in most of the all over the country, the general people is very much terror. They are very much frightened with the concept of these, not only of modern medicine, even from Ayurvedic system of medicine. They are terrified. They are because they now learn to hate medicine. They want to be a good one with good health, with good immunity, with natural food, with being going to close to the nature, and with the meditation, with the yoga. They are thinking something in new perspective. That is the also the health perspective thinking of World Health Organization. They never recommend this type of complex thinking, this type of more or more drug addiction to the patients within the physiological domain. In clinical medicine, the 60 is also the normal pulse rate, the 100 is also normal pulse rate, because it is the variation is there depending on the man to man, according to age, according to society, according to circumstances, according to physical makeup. So 60 may be normal to 100 may be normal to 1. So these are the range. So we have to identify who is disease, like aphorism 3, what is to be cured in the disease, whether the patient require medicine or not. This is very important. So physical illness has structural or functional elements of these adaptation. This is the thing. These adaptation. Physical illness exists within material, cultural, and institutional environments through which the individual exits, moves, and interacts with. The very wonderful line in the red, the second one, that it exists within, in which it exists within material, cultural, institutional environment, everything, and many other things. So we have to adapt with this. Whenever maladaptation, you will develop a different type of disease depending on your individuality. So scientific integrative medicine is not a discipline, a group of disorders, or a method of treatment, but an approach, a way of thinking. Scientific integrative medicine uses systems concepts to explain disease process and develop strategies to treat, prevent, or palliate them. Even palliation in constitutional method will give you a good result. And nowadays, most of the, in our Calcutta, in our West Bengal, most of the oncologists, the cancer specialists, having a very good background of homeopathy, they are preferring the palliation mode through homeopathic system of medicine. They can use Kondorango, they can use cadmium salt for the bad effect of the vomiting after the chemotherapy. They want to reduce the burden of modern medicine through the justified use of homeopathic medicine in a rational way. This is the real integration with the concept. Even the palliation may be done in the constitutional approach, not from the specific point of view. It emphasizes disorders of the multiple interactive systems that regulate the body's inner world. So our inner world is influenced by the multiple interacting system, very many interacting system. I will show you in the next slide. This is the psychoneuroimmunology. We have considered the psycho, you have considered the neuro, we are concerned about the immunology. So whenever you are feeling depressed, whenever you have a grief, whenever you have heard any news of your very close relative death, and your feeling is so sad, you are feeling, so everything will be depressed. The depression may be reflecting in your peristaltic movement. For that, the next day there will be constipation. The reflection may be in your mind. So you are feeling so much depression. The depression may be in your immunity. So if it runs long, the immunity markers with the immunity status will be changed after 1 month or 2 months. It is not that within 1 day or 2 days, but if it lasting long, then your immunology status will change. So your psychoneuroimmunology, even you can add with this the endology. The psychoneurology is a very common thing. Now the immunology add. Now with the concept of endocrinology, with this psychoneuroimmunology, it becomes the holistic. Whatever we tell about holistic, whatever we tell about a single point of vital force, within the vital force, everything, it is the thing that is in the name of, even maybe in the name of force or life principle, vital principle, but something is there, because it is the thing. You just think of aphorism 10, that without this, it has no function. Like in section 9, it is the definition of vital force. In the section 10, without the vital force, it has no function, no self-preservation, like in section 10. So these physiological explanation is there for your life force, for your life principle, for your holistic concept. So you can't say that this is homeopathic philosophy. Right now, one first year student of first BHMS, they should not feel inferior that this is the concept of homeopathic physiology. This is not. This is the homeopathic physiology. This is the homeopathic philosophy on the based on the physiology, the medical physiology. So medical physiology, what tell 200 years back, our philosophy is the same thing. You know the difference between the philosophy and the science. Whenever anything of the science cannot be explained, that is called philosophy. So when the scientific background of homeopathy or the scientific explanation of very many things like vital force and life principle cannot be explained, at that time it was called philosophy. But now whenever it is explained in the light of your medical physiology, so it is now in your rationality. It is now become science. It is not within the domain of philosophy. Every part of organon, every part of homeopathy is now not under the domain of philosophy. Most of the part within these 210 years, it becomes science. It becomes science. At that time, even up to 12 potency, there was no molecule. You cannot think of nanoparticles, like not only of Joyce Bellady, before that Dr. Mahata, like that of Dr. Hudabaks and Dr. Sukul, all the, even the Dr. Paranjape of Tata Bhava Atomic Research Center, all those scientists, Dr. Paranjape, Dr. Jindal, all they have identified the molecules. They have identified the up to 12C, but the 30, 200C, the research is going on. Within this part, we can, because it is a unique one, our concept of science, it is confined within the domain of Avogadro's law. The time is coming when that science will, we have to rethink about the concept, because the quantum physics, the coherent domain, all this quantum electrodynamics, what is talking, it is not talking according the line of Avogadro philosophy, Avogadro thinking. Because if the Avogadro point is true, then this quantum electrodynamics and the quantum physics, that is not true. But this quantum philosophical thought is very, very similar to our concept of this individualization, our concept of single molecule, our concept of no particular genetic predisposition. These are the very common, and we have the evidence. So concept of holistic health, very much similar with the psychoneuroimmunology. Interrelationship within the economy. Within the economy means within the health, within our health, everything, everything. Because our why just thinking of any good food stuff, like just thinking of good fish, hilsa fish, to Bengali in the rainy season when drizzling is there, all the Bengalis will have salivation. So there is interrelationship. Just a visionary concept can cause your salivation. So how dynamic is the physiology, is the economy of us, and for this we can have the appetite even after the full within 1 hour or 2 hours. If the food stuff is too good, so we can take again, because our desire become the craving. So these type of interrelationship within economy, it is depending on the triggering factors, it is depending on the environment, it is depending on your own reactions, your own individuality. All these matters, and the harmonious movement of health in an integrative way. The wonderful explanation is in the section 9 of the aphorism of our in the healthy condition of man, the spiritual vital force, the dynamics. This is the section 9. Wonderful, the harmonious movement. These harmonious movement can be explained with the psychoneuroimmunology. So concept of integration differs. This is something different. Concept of integration differs. How? The modern medicine, what is the modern medicine concept? If you think of anatomy, the concept of integration in the first preclinical subjects, it is in the as because I am in the homeopathic education, so I can give you the example of the education system. Whenever it is the preclinical subject, so anyone is learning, anyone is teaching with the concept of your muscles in anatomy, with the applied part of anatomy, like hamstring muscles, all the muscles attachment, all the muscles are origin from the ischial tuberosity, all the muscles will be inserted below the femur, like all the muscles will have same nerve supply, all the muscles have the same type of function. These are the concept of hamstring group of muscle. But why hamstring pull is there? What happened in the hamstring pull? This is your physiological process that can teach you about the nerve muscle physiology. What happened in the muscle cramp? Why that teaching pain is there? What happened, like wry neck in the sternocleidomastoid? You are going through the anatomy, sternocleidomastoid attachment, and the sternocleidomastoid, the applied part is for advanced students. It is written in a good anatomy book. The wry neck. What happened in the wry neck? Why this wry neck happened? If you want to understand the behind the what happened behind the curtain, that is your applied physiology within the applied anatomy. This is the real integration in preclinical subject. These integration also can be reflected in pathology, from the classes of anatomy and physiology, with the amalgamation of the concept of applied anatomy and applied physiology, that can be reflected in medicine. And ultimately this concept of applied or concept of pathology is reflected in clinical medicine. If you have an idea of the necrosis, and the necrosis in the form of three types of necrosis, of caseous necrosis, gametous necrosis. You know the caseous necrosis, tubercle is the soft lesion. In the gametous necrosis, gamma is the hard lesion. So gametous necrosis, it is like rubber. Gamma, it is rubber-like. The syphilis, gamma, it is rubber-like. So, am I audible here? Am I audible? Visible? Hello?
Yes, sir. Yes, sir.
Okay. So,
Yes, sir.
okay, thank you. So these gametous necrosis, this gametous type of necrosis, and this rubbery feeling also, and the soft feeling of the tubercle, this is the very unique feeling of tuberculosis in pathology. But whenever we are entering into of practice of medicine, we are thinking of tuberculosis, and tuberculosis, whenever we are thinking of gland, the tubercular gland will not be very hard like cancerous growth or like any nodes or any. It is between soft and hard. It is between soft and hard. So the tubercular, the very basic pathology of the gametous necrosis of the syphilis, which teaches us about the gametous necrosis, which teaches us about the end arteritis obliterans. This is the applied pathology. This is the integration in modern medicine. This type of very many integration, even within the knowledge, with the knowledge of parasites, with the knowledge of Entamoeba histolytica. Whenever it is in trophozoite form, you have acute amoebiasis. Whenever it is in cystic form, you have the chronic amoebiasis. And these amoebiasis can cause ultimately you, if it is in chronic form, that may cause you amoebic abscess. It may cause your liver damage. It may be the first point of your fatty liver. It may be induced by the parasite. There are very many causes of fatty livers, but also this one of your chronic amoebiasis movement, even the ascariasis. In the childs, the ascariasis may cause the fermentation of the stool, that may cause the pain abdomen. The most of the child having the pain abdomen, colic in the abdomen, due to maybe the fermentation done by these earthworms. So these are the thinkings of modern medicine, of concept of integration, where concept of applied anatomy, applied physiology, applied pathology with the medicine part, even it is reflected in gynecology, obstetrics and surgery also. I will go through the next slides. So in homeopathy, concept of integration something different. Concept of integration, homeopathy never divide it into mind hyphen body reaction. Usually it is said, na, your homeopathy, it is the mind-body reaction. There is no hyphen between the mind and body. There is no hyphen between the psycho and somatic. Homeopathy believe in psychosomatic. Homeopathy believe in mind-body reaction. No gap between mind and body. Like whether you have noted or not, psychoneuroimmunology, there is no gap between psychoneuroimmunology because it is the truly holistic. There is no space in between that. So homeopathy believe in this type of integration. Simultaneously, whatever you have received grief or whatever you have received dynamic, any injury, dynamic trauma that may be reflected physical level simultaneously. There is nothing that it is in the mental domain, it is in the physical domain. Even this type of thinking is not common in homeopathy. So modern medicine concept, integrated anatomy, physiology, pathology, integrated medicine, I already told this. The very, very important one. Even I can give you one example that is of congenital hydrocele or like herniation, and there is the passage from the inguinal canal. It is still open. Processus vaginalis. It is open. And the patient having this come to you with the purely surgical conditions. So this is a part you have to know that there is undescended testicles in male because processus vaginalis is still open, but the testis is not come to its normal position. So this may be a symptom of hypothyroid patient. That's why it is the clinical symptoms of thyroidinum. It is not that you will give thyroidinum and the patient will, the undescended testis will descend. Homeopathy is not like that. If the patient is of thyroidinum, if you are finding something constitutional symptom of thyroidinum, you can give thyroidinum. Otherwise, sulfur may cause, otherwise, aurum met you may give, otherwise, thuja may, lycopodium you may give, anything. If the patient is of that constitution, that constitutional similarity, that may work. But thyroidinum can produce this type of clinical symptoms, which is in its drug-proving part, human pathological trial. And it has the potentiality to develop this processus vaginalis open, the undescended testis. So this is also concept of integrative concept. This concept is from anatomy, physiology to the surgery. And now as a homeopath, you are thinking of medicine with the applied mathematica, and you are applying your concept of mathematica of lycopodium, your thuja right-sided or left-sided or lachesis or thyroidinum, whatever, you are applying your constitutional mathematica portrait of disease to the disease portrait of the children. So this is also integration. This is also integration. So our integration something different. Modern medicine, integrated medicine, whatever it is been the clinical medicine, it is the concept of integrated anatomy, integrated physiology, integrated pathology, integrated gynae-obstetrics, even the surgical diseases with the practice of medicine, clinical medicine. How can you justify the heart sound of your first? You know that the first heart sound and second heart sound is clinically audible, third heart sound and fourth heart sound is not clinically audible. But in mitral stenosis, we can have the murmurs of the mid-diastolic murmur with pre-systolic accentuation. It is a very oftenly said by the teachers of the faculties in the clinical medicine class that because mitral stenosis is very important, there is stenosis between the left atrium and left ventricle, so blood not passes to the left ventricle so much, so it accumulates in the left atrium, ultimately it backflow, there is accumulation of blood in the lungs, even in the rupture, so hemoptysis may occur, even in the cardiac disease, even the right ventricular failure, ultimately because so much blood, so there is accumulation of blood, there is right ventricular hypertrophy, ultimately right ventricular hypertrophy with the right atrium also blood may accumulate, even the pulsatile liver may you see in case of functional incompetence. These are the things going on. And in the left ventricle, as because there is no blood, so blood is very less, not no blood is very less, so left ventricle is pumping too much, so there may be palpitation. This type of thinking also of integrative thinking. But why there is mid diastolic murmur with pre-systolic accentuation, you cannot explain without the concept of cardiac cycle of last rapid filling phase of applied physiology. This is the concept of integration in modern medicine. This is the concept. So these integrative medicine, so concept differs from modern medicine to homeopathy, from applied part to teaching part. So there are so many things to tell about integrative concept. Now we should now change of topic to genetic predisposition. It is our individuality. Nowadays, it is very common to say it is an increased likelihood of developing a particular disease based on a person's genetic makeup. A genetic predisposition results from specific genetic variations that are often inherited from a parent. So it is not new to us because we are familiar to our miasmatic dyscrasias, to our individualities, generalities. What is our desire, aversion, intolerance, liking, salivation, sleeping pattern, sexual instinct, everything. These are all our generalities. These are nothing different from these, because all these will reflect the genetic character. So genetic predisposition nowadays, it is the language of science. These genetic changes contribute to the development of a disease, but do not directly cause it. Some people with a predisposing genetic variation will never get the disease, while other will. Last yesterday's seminar, I was telling, even with HLA-B27 positive for the lifelong, but the patient do not even not develop ankylosing spondylosis throughout the life, because the environmental situation and the accessory circumstances of the patient was not going uh, not going against him or her. So it was the favorable conditions he gone through. So being HLA-B27 positive, he never developed because halada ऐसा तैयार नहीं हुआ जिससे वो disease बन सके. As accessory circumstances halat, these are the events that cannot be happened. So the disease also not happen. So the genetic changes contribute to development of a disease. हो सकता है कि you are very much predisposed to develop this disease, but whether it will happen or not, that will be depending on your action. So as a doctor, if हमें पता है कि इसको ये disease हो सकता है, कि ये syphilitic predominant है, इसको cirrhosis हो सकता है, उसको fatty liver हुआ है, तो syphilitic predominance जानकारी है ना मेरा पास. So as because I know the syphilitic predominance, so I may warn the patient, don't take alcohol because you are very much predisposed to have a very bad type of disease which may cause fatal in the future, because you are like Jyotish. You are already everything known about the patient's individuality. The recent developments in biology have made it possible to acquire more and more precise information concerning our genetic makeup. That is called Human Genome Project. It's very important one. It's a very important work we should do on, and we should give emphasis on this, because the Human Genome Project is going on. So much thing right now. This pandemic COVID-19 is going on, and all the type of virus, different genomic studies going on. But about the human constitution, the Human Genomic Project, if being a homeopath, we should know psychosis. We should know. The study already we have started at our institute, Calcutta Homeopathic Medical College, the predominant Sora genomics, the syphilis genomics, psychotic genomics. That is the very beginning, but is a lot of fund required. Right now we are going through the pandemic situation, so our work halted, but it will be a very good work, because already Ayurveda has made it. Ayurveda made the Bayu Pitta Kapha, the genomic study. They have lot of papers and wonderful study. Even our Calcutta College also was connected with it. It is a multi-central study, collaborative study, and they have made it. So their genetics, they can be explained, their Vayu Pitta Kapha in the language of science. But till date, we are talking about Sora, syphilis, psychosis. But we can show you all the manifestations of syphilis. It is very common to some people. So all those people's, if genetic trait we can identify, and these genetic sequence, these genetic genome project can say that this type of genetic makeup will be a tendency of this type of disease. Already this type of work is going on the basis of genetic project, but not on the basis of our Sora syphilis. psychosis. Nowadays, the scientists tell that just by taking your genomic project, by your genetic makeup, they can tell you are predisposed to this type. Your this part is weak, your this part is strong. So you already well known. The time will come within 5 to 10 years that all we have must have one genetic makeup in our pocket with a small chip. So this is a wonderful opportunity for homeopath to make its organon of medicine miasmatic concept scientific, to convert it to scientific. So concept of homeopathy, holistic health, already told, dynamic cause of disease, miasmatic dyscrasias, accessory circumstances, individualized approach, and the unique one, that is the bonding with the patient in its application. Wonderful. This is a through case taking. Whenever we are taking the case, through the exhaustive case taking, we are making the bondage with the patient. With the doctor-patient relationship is very good. So we are making the bondage with the patient. The patient can narrate everything about her or his weakness, whatever secret she can narrate. So this bonding is unique through our case taking part, which is simultaneously going on through our case taking part, the counseling part. The counseling is nothing different from if we do a very good case taking of a patient in face to face, 1:1, then the simultaneous counseling will be going on for chronic disease. It is not applicable to acute disease. Very wonderful lesson Dr. Hahnemann gave in 210 to 230 in the mental disease, that how not only that how the physical symptoms disappear and the mental symptom come, and which one of doubtful origin, which one of physical and which one of mental, and you have to know that which one is somatoform and which one is the organic disease. So there are clues how we will proceed to the cases, what type of case taking we should do, and what should be our approaches. So the bonding prepared during this type of exhaustive case taking. When patient will come closer to you, you will go close to the patient. So this is the unique doctor-patient relationship. Even it is very good for the young homeopaths. The patient will give you time, even if your selection is wrong. But because bondage has completed, you have made bondage with the patient. So patient will not leave you. This is the another advantage for the young homeopath. So these are our gems, the concept of homeopathy and integrative clinical medicine of homeopathy. This is our today's topic, that the integrative clinical medicine. Now we will talk about the diseases. Now we will talk like respiratory medicine, COPD, chronic obstructive pulmonary diseases. We know chronic obstructive pulmonary diseases are of three things, that is chronic bronchitis and emphysema. That these two should be under COPD as per Davidson. But if you consider the Harrison's internal medicine, then bronchial asthma also should be considered through the COPD. Why? Because the manifestations are same in all these conditions, similar. The shortness of breath, dyspnea. Previously it was called dyspnea. Now it is called shortness of breath. So in COPD, the severe respiratory distress, the shortness of breath are there. But how it differs in clinical medicine, if you go through the applied physiology, applied pathology, in chronic bronchitis, there is inflammation, there is sluggish ciliary movement, there is mucus gland inflammation. So much mucus gland inflammation, so much goblet cell increase and mucus production. Ultimately, secondary infection is there. There is Haemophilus influenzae. And in very many patients of chronic bronchitis, more than 50% patient of chronic bronchitis just convert to emphysema. And what is emphysema? The emphysema is a permanent dilatation of the lung alveoli. So if the alveoli is so permanently dilated, there will be more air trapping. The air will take entry, but air will not pass. So there will be shortness of breath. So how difference in the pathological point of view or applied physiological point of view? Again, the emphysema can be the major source. Even it may happen without chronic bronchitis if there is congenital deficiency of alpha-1 antitrypsin enzyme. If there is alpha-1 antitrypsin enzyme, it is deficiency, then you can think of emphysema. And why it happened? Because these alpha-1 antitrypsin enzyme, it is the responsible for making the integrity of the alveolar wall. If the alveolar wall is very thin or friable, then this one alveoli wall will break and another alveoli will add. Then 4 or 5 alveoli, the alveolar wall, by breaking the alveolar wall, one big alveoli, which is called emphysematous bulla, and there will be so much shortness of breath. So these are integration thought in clinical medicine with the pathology. And the bronchial asthma, the something different, not at par chronic bronchitis or emphysema. Here antigen and here allergic manifestations are there, external and internal. allergic manifestations are there. Something triggering factor is there. That triggering factor may be environmental, that triggering factor may be internal. Because we can remember the natrum mur, urticaria from violent exercise. You just think of the pathology of the urticaria and think of the pathology of bronchial asthma, it is similar. It is similar. It is similar in because it is the hypersensitivity reaction in the sense of these similar type of hypersensitivity reaction may cause in case of bronchial asthma. It may cause that the 2 or 3 other factors are there for bronchial asthma, but mostly the allergic reactions, hypersensitivity reactions are the reactions behind the bronchial asthma. This is our clinical medicine, but in the integrative way from the applied physiology and applied pathology. This should be our integration. So our medicine also, like whenever you are thinking of arsenic album, the arsenic album patient is from 12 to 2 or AM or PM aggravation. So whenever patient is lying down and patient having shortness of breath, so you may think of this is the shortness of breath, so it may be of bronchial asthma. It may not of bronchial asthma, because the left ventricular failure patient, if there is pulmonary edema in the heart failure, whenever patient will lie down, he will have a suffocative attack. He will just sit up. So it is the typical disease pathology for which patient can. So arsenic album may produce this type of symptoms. That may not be happening in bronchial asthma. That may be happening in case of cardiac asthma. In cardiac asthma, you know the asthma 2 type, bronchial and cardiac. In cardiac asthma, the pulmonary edema is the sole cause of the shortness of breath. So it differs. Pneumonia, how wonderfully they have differentiated pneumonia with the different diseases. Different diseases. They have wonderfully identified, not only identified, they have separate. They have made the separation of the pneumonia different from pathological point of view. They are talking of Legionella disease. They are talking of Legionella gram-negative bacteria, which is the more primary cause is the cooling towers of air conditioning system. Cooling towers of air conditioning, hot water plumbing. Even the diagnosis is difficult because it is very difficult to culture and requires special media. The Legionella disease, the Legionella type of pneumonia is something different from Mycoplasma. These Legionella, the fatality is too much, like Legionella and Mycoplasma, Klebsiella. These two, the Legionella and the Klebsiella, in these two pneumonia, there are so many patients may die. The Mycoplasma, it is occasionally viral, the Mycoplasma. So they have individualized the pneumonia with the pathology and with the symptoms, but they have not considered the man. This is the basic difference with us. We will consider Marksall type of pneumonia, right-sided affection with the salivation, etc. Calcutta cup type of pneumonia, phosphorus type of pneumonia, bryonia type of pneumonia, kind of pneumonia with the manifestation with the human reaction within the drug proving of the drug medicine, that bryonia, phosphorus, what symptoms they produce like pneumonia. So these are the type. This is our approach. This is our integrative thought with the applied mathematica, drug proving with the pharmacy and with the clinical medicine. But their concept of pneumonia, that this type of streptococcal or staphylococcal bacteria, there will be very sticky, very sticky and very thin type of discharge, not rusty colored sputum. Maybe in the long run, it may be rusty colored sputum. In Klebsiella, it is darkish, it is dark black like sputum. It is dark black like cough with the expectoration. So they have made the differentiation with the disease pathology, with the symptom pathology. But this differentiation was not there even 15 years ago or 10 years ago. Only said pneumonia, difference by bacteria, virus, parasite, lobar pneumonia, lobular pneumonia, interstitial pneumonia, but they have not differentiated with the minute disease symptoms. Just 7-8 years back, or maximum 10, not 10 years, 7-8 years back, they are now individualizing the disease with the disease pathology. At least they are trying to make similarity with our concept of individualistic concept. That was not there. Only pneumonia means the pneumonia, a type of lobar pneumonia, and another is asphyxia pneumonia, like that. The kerosene oil consumed and ultimately pneumonia. So the artificial, this type of pneumonia. So there are differentiation. Now within the lobar pneumonia, interstitial alveolar pneumonia, there are 10, 11 types of variation depending on the bacteria viruses, not only on the bacteria viruses that was there, but on the basis of their symptomatology. Cetaceous pneumonia, which is caused by bird flu or like symptoms, like avian influenza like symptoms, where cetaceous cause, it is the bird's pneumonia, in which it is very minimal. Disease pathology is very minimal. It may occur within 6 to 7 days, it may spontaneously disappear. So pathology is so simple, but Klebsiella, it is very severe. So this type of individualization they have already made with all these pneumonia. Even right now, it is a SARS-CoV. It's a 2003. The mortality was 10% to 15%. It was also the coronavirus, short incubation, interstitial pneumonia. Only steroid was their treatment and something antiviral drug. But now COVID-19, if you just go through the first advisory to up-to-date advisory, there are so many advisories, so many theories. Same thing, the theoretical medicine is going on. What are the causes? What are the factors? Why? How it happened? When it happened? So many research, so many laboratory findings. Till date, we have not concluded anything. But we have concluded that the infectivity is too much. Fatality is within 1 to 3% only of COVID-19. This we have concluded. Even it may change depending on the perspective. So there are think also these type of thinking also are within the domain of clinical medicine and the integrative approach. The thinking of tuberculosis on the basis of miasmatic dysplasias. The soric component, the soric spora predominant patient will develop a type of tuberculosis which will never happen. The like your allergic type of tuberculosis, or it is called afebrile type. It is called that patient, just seeing the patient, you will feel the patient might have tuberculosis or patient will develop tuberculosis. But patient will never develop tuberculosis if this soric predominancy will be going on. And he will develop pityriasis versicolor manifestation along the skin. He will develop much coughing, but there is no cavitation like your post-primary tuberculosis, adult tuberculosis. If the patient is syphilitic predominant, your cavitation will be there. If the patient is of psychotic predominant, miliary tuberculosis may happen. So if we have idea of the patient's constitution and the individualistic constitution and the miasmatic dysplasia, we can think of what type of tuberculosis will happen to what type of patient. The same thing in case of pneumothorax. Whether it is open, whether it is closed, whether it is valvular, you know the valvular pneumothorax, tension pneumothorax, in which so much heavy breathing distress is there. It is called even so air accumulated there. If you percussion, there will be tympanic sound like abdomen. So it is called tension pneumothorax. Valvular pneumothorax, the huge one in which patient tell, I cannot breathe. This is the giveaway sensation that I am dying. It is better to die. This is the concept of pneumothorax. The subjective feeling of pneumothorax is that I am dying, give up. The subjective feeling of hydrothorax, where water accumulated, in case of apis mellifica, this is my last breath. I cannot take the next breath. So subjective symptoms differ. So apis mellifica can produce the symptoms of hydrothorax, not of pneumothorax. But antimarts can produce the symptoms of pneumothorax like giveaway sensation, give up sensation, और नहीं सहन हो सकता, इससे मर जाना बेहतर. This type of thinking, subjective symptom. So this type of integrative thinking and it is this valvular type of pneumothorax. It is very much common to predominant syphilitic and psychotic both. Now, if we give example of cardiovascular disease, the angina pectoris with the stable, unstable, and fringe metals, you know the fringe metals, the typical fixed date, fixed time of anginal attack, which will indicate predominant psychosis. Again, the unstable one with the sudden spasm, but why happened, when happened, what, but it is not known to you, but that may cause death of unstable. So it just make you think that it may be of predominant syphilitic miasmatic origin, like stable one of soric origin. So heart failures, the different state of heart failures, you know the left ventricular failure, right ventricular failure, the patient, the longevity of the patient of right heart failure, of left heart failure, even the heart block, whether the patient will stick in the first degree AV block or it will go to the second degree AV block, the complete heart block. This differs on the basis of your constitutional treatment. It is nothing you can say it will happen. It happened. Nothing happened just idiopathically. Everything is predestined, or if it is not predestined, it is on the basis of your environmental and accessory situation what will be happening. The sudden patient having diabetes, and he is very much prone to develop any type of small vessels injuries, and when sudden emotion come up, sudden emotion, and suddenly she gripped or humiliated, and sudden myocardial infarction appear, because this is the environmental circumstances which trigger up the function. Even if the patient is of psoric predominant, he may not die. But if the patient is of predominant syphilitic or psychotic predominant, patient may die instantaneously. He cannot cope up with this environmental trigger. This should be our understanding. Is subacute bacterial endocarditis. You know subacute bacterial endocarditis, SB, very commonest form. There is so murmur. It is told that without murmur, no SB. So, and the typical pallor. Why typical pallor? Because all these bacteremia, all these multiplications of these bacteria, that can cause destruction of the small capillaries all along the body. So there is typical hemorrhage all along, even the under the nail, under the eye sclera, Roth spot. This is the Hodder's Nile, etc. Osler's note. Everything we can find in SB, because so much minute hemorrhage is going on. But why hemorrhage is so easy? It is too common to predominant syphilitic origin, not to the predominant psoric. So this should be our understanding. Congenital cyanotic heart disease is the same type of thinking. The time is too short to explain all these things, but my essence of my gist of my what I want to establish is that whatever you think the disease from complete, from holistic point of view, from integrative point of view, whether you have peptic ulcer or gastric ulcer is not important, but whether you have a stress, whether the bacteria, even the H. pylori, Helicobacter pylori is of no importance. Nowadays, it is 50-50 that one authority told that H. pylori should be given the anti-H. pylori medicine, the another authority telling it is nothing to no advantage you will get by giving anti-H. pylori medicine. It is just like your virus in the computer. It will remain whatever quick kill or whatever antivirus you will be there, the virus will be there. So like the peptic ulcer, IBS and IBD, the typical predominant psoric patient will develop IBS, irritable bowel syndrome, but the predominant psychotic one will develop Crohn's disease. Predominant syphilitic one will develop ulcerative colitis. So these should be our understanding. And also from applied physiology and pathological part, you can know that from the very past, the patient having the condition of the treatment going on of his abdomen, related to abdomen, patient having the syphilitic background. So ultimately the patient will develop ulcerative colitis. The same thing. Chronic diarrhea may be due to malabsorption. Chronic diarrhea may be due to intestinal tuberculosis. Chronic diarrhea may be due to something acute exacerbation for taking something food which is rotten. Chronic diarrhea may be common to steroid induced, who have taken steroid for treatment purpose, steroid induced chronic diarrhea. Chronic diarrhea may be very common in AIDS, acquired immunodeficiency syndrome. So there are so many causes of diarrhea. You cannot say, so the diarrhea in the child without any cause, first after birth diarrhea, this is your clue of first illness, the child having predominant psoric background without any cause, first diarrhea. You cannot say it's psychotic or syphilitic. So this type of integrative thinking we should have. This is the IBS, you can see this is the IBD. Arthritis, different type of osteoarthritis, rheumatoid arthritis, gouty arthritis, spondyloarthropathy, there's so many things. 87 varieties of rheumatoid arthritis, including seropositive and seronegative. Within the osteoarthritis also, nowadays, it is not called only as degenerative disease. It is also called autoimmunity mediated disorders. Not only, it was very common to rheumatoid, but now also it is explainable for osteoarthritis. But gout, it is a purely metabolic disorders. But right now it is told it is not metabolic disorders, it is lifestyle disorders, because you are taking excessive fat, you are taking excessive protein, you are taking meat. Previously it was monthly one or even weekly one, only 2-piece meat you consumed. But right now it is you are taking chicken twice or thrice per day. You are taking all the foods which is very good protein, and you are taking alcohol. So you have developed your, and you are predominant syphilitic, you are predominant psychotic, you are greedy, you are miser. So you have developed your concept of hyperuricemia condition. So ultimately you develop gout. So you modify your lifestyle. Only lifestyle modification can give you cure from your hyperuricemic condition. But if it is genetical, if you are genetic predisposed to, then the constitutional treatment can only help you, and with the diet modification and exercise. This should be our concept. Spondyloarthropathy. You have so many patients in your chamber with symptoms of arthritis, but not you have diagnosed anything, either RA factor negative, anti-CCP negative, no degeneration, no osteoarthritis, uric acid normal, everything is normal, but patient is complaining of arthritis or pain in his body. Thyroid is normal. So there is something, somatoform disorder, something dissatisfaction in his economy. Dissatisfaction maybe in his office. Dissatisfaction maybe with his marriage. Dissatisfaction maybe with his friend, it is environment, maybe within his family. So some maybe political, maybe economical. That answer, not satisfied sensation, may be reflected in the health in the form of arthritis. Whenever it is in the form of headache, migraine, it is in the form of your never satisfied gut, then always going and like Nagsvomika, never satisfied stool, ineffectual urging. So this is the typical philosophy of Nagsvomika, never satisfied with anything. So it is very common to the careeristic people who just want to go to up and up and up, never satisfied. The same thing reflected in the stool. This should be our dynamic concept. This should be our concept of integration. This is the same rheumatoid arthritis, rheumatoid criteria. All these are things. This is a new thing, SSA, seronegative spondyloarthropathy. Whenever you are confused, nothing come up in your diagnosis, no pathology, you think of seronegative spondyloarthropathy. Under this domain, everything you can see, the reactive arthropathy. After diarrhea, you develop sudden arthritis. It is very common to your pulsatilla, to abrotenum, to very many homeopathic drugs. So you can use it. Reactive arthropathy, even in AIDS, even in chronic amoebiasis, even in chronic diarrhea, arthritis there. Even right now, you can get the patient of chronic heel pain. If patient is not obese and patient is not wearing very hard shoes, then the constitutional treatment required, because something wrong is going on in his or her economy, some dissatisfaction. That is the totality of that case, in particular that patient. You have to search out as a good homeopathic physician in the chronic case. That is unclassifiable chronic heel pains, even the single tenosynovitis pain. It is not that you will give ruta or you will give benzoic acid and you will cure. You may get the palliative treatment, but if it will be reappearing, it will reappear. Only your constitutional treatment can help the patient. These are the extra-articular manifestations of SSA. Patient may give you only aphthous ulcer, without any. You are applying vitamins, you are applying mark salts, you are applying borax, nothing. The economy is in fault. So you have to think constitutionally. Red eye, gastrointestinal tract, in diarrhea, dysentery, everything. Ankylosing spondylosis, you are fixed, you have confined yourself within your circle. You are not open-minded. You are very miser, not from money, not from monetary point of view. You are miser from your mental point of view. So if your mentality is very confined, very restricted, ultimately that will be reflected in your physique, in your physical level. So you will be creeping within the time. The ankylosing spondylitis will develop in you. Whether you are HLA-B27 positive or negative, that doesn't matter. I have seen so many patients HLA-B27 negative but having the ankylosing spondylitis. And if it goes beyond the pathological level, a certain limit, You can't give the same patient, you can't cure the patient. You can improve by applying your medicine up to a certain level, and you have to take also the yoga, physiotherapy, and the mental. You have to give a good counseling within whenever you will be observing your patient, because your word, your advice matters to your patient if you have developed the bondage with the patient. These are ankylosing spondylosis. This is SLE. Same thing, palindromic rheumatism. Palindromic rheumatism. This is another one with the palindromic. What is palindromic rheumatism? It just simulates rheumatoid arthritis like that, the pain. But it is not rheumatoid arthritis. There's so much pain, tremendous pain. Patient has to take some like paracetamol or even the painkillers, even he may say, but RA factor negative, everything negative. These may be the precursor of rheumatoid arthritis, palindromic rheumatism, plantar fasciitis. These are all. So the environment, genetic factor, disease psychology, these are all important. The autoimmune disorders, we have to think where the friction is going on, where the friction is there, autoimmune disorders, why this is happening, why the body's own substance cannot be identified, body own. I cannot identify why this is happening. The friction is going on. What are the factors? So only identifying the markers is of no value for the treatment. That's why they are still hunting the medicine of autoimmune disorders. Even how blunt this thinking that they are giving the medicine which will cause decrease in your immunological response. They are giving medicine which can cause decrease of your immunological response. So your autoimmune disorders disease will be very good. You will tell, oh, it is improved. But they have given you medicine for decreasing your immunity level. So you are prone to develop very grave diseases of very many forms. This is very blunder. So the same thing in case of our renal disease, of your minimal Nishan glomerulonephritis, of psoric predominance, of the membranous proliferative glomerulonephritis having the psychotic predominance. So the chronic renal failure patient, which patient will go to the chronic renal failure state from the acute nephritis, from the nephrotic syndrome to the chronic glomerulonephritis, it will be depending on your miasmatic dysplasias. The same thing in case of stroke, whether it will confined into transient ischemic attack or it will go to the next step of reversible ischemic neurological deficit like second step, or it will go to the direct stroke. A predominant psychotic patient may develop first the fourth one of complete stroke. Whether the cerebral thrombosis, even the how wonderful we have the symptoms like arnica, within the talking, within the replying, the patient go through the stage. This is the symptom of bacteria and arnica, the differentiation. So also in case of cerebral thrombosis and in case of cerebral thrombosis, whenever the thrombosis appear, then there will be scanning speech. The speech will be scanning. My name is Rajat. The scanning speech is there. And whenever it is hemorrhage, he will be unconscious. But if the hemorrhage is in pontine area, then there will be fever, with the pinpoint pupil. This is the sign of clinical medicine. And if it is of cerebral infarction, then patient will talk irrelevant. Even the very, very saint type of people may cause of nuisance, may say tale of nuisance, may tell of sexual very bad things, very abusive words of the saint-like people. These are the symptom signs of cerebral infarction, maybe the lacunar infarction specifically. So these are the signs already known to us. These are the knowledge of disease, knowledge of practice of medicine. What is the indication? The indications is what are the miasmatic dysplasias you are finding, or what generalities you have gathered from the patient earlier, from the early history, or from the his relatives or the surroundings. What you have collected. Those are the generalities. Those are you are searching for indications in that patient. So the man in health will go to man in disease. And the multiple factors, so we have to search the multiple factors, and we have to identify the man in health in his society. So we have to identify also the disease. These are the different types of associated body reactive focal behavior. So attention deficit hyperactive disorders. In case of child, you can see the very important one of this one. This is associated body focused repetitive behavior, associated BFRB. This is the and addition ADHD also. These are all you can see of within the hyperactivity child. So the abusive, why it is a one, not abusive, it is abundant. It is a rubric. Even it is in Mac or Macmu, you can find that the when the parents bonding is not good with the child, there is friction in the family. So these are all things. Even some iatrogenic drugs, some prophylaxis-like injections, some progesterone injections, some to prevent abortion. This type of condition can cause this type of hyperactivity. You can see this child who is always very much hyperactive, but within the TV, she is totally stopped and she is totally halted. And she fond of horror films, seeing the hyperactive thing, because her mind is now with synchronous with the television. There, anyone is running, so she is running within the television. This type of thinking we should develop. The dyslexia with the syphilitic predominance. The top 10 lifestyle disorders. These are the top 10 from Alzheimer's, atherosclerosis, diabetes, nephritis, stroke. But our concept of all these one, like this, from homeopathic standpoint, with the clinical medicine, with the homeopathic standpoint. So just obesity can cause 87 type of disease. If you just reduce your weight, you can prevent 87 diseases. Even the small word, this is the venular stasis disease. No disease at all. Just reduce weight, your this stasis, venous stasis will go. Polycystic ovarian disease, even PCOD, like reduction of weight is very important in case of management of PCOS and PCOD. Stress urinary discontinuity, even the GERD, gastroesophageal reflux disease. Your obesity is matters with the GERD. This is very important. So this type of thinking we should have with the lifestyle modification in new beginning. And these should be our I am in the last part of my slide. There's the integrative understanding of clinical medicine. How we can integrate, like a patient come to you with hoarseness, or anyone is talking of hoarseness, then hoarseness, it may be common to the professional singers, to the professional orators. Like we are talking more than 3 hours, 2 hours, 4 hours, and repeatedly. Just after 1 hour again, I have to talk anywhere for 2 hours. So professional orators, professional singers, they may have developed hoarseness due to bulky vocal cord. Why so quick bulky? Because the patient is predominant psychotic, so he become predominant. Again, in another patient, the hoarseness is there, and the professional orator or professional singer, but there hemorrhage in the vocal cord. Whenever there is hemorrhage in the vocal cord, the patient, the voice become husky. Why hemorrhage? Patient is predominantly syphilitic, so hemorrhage occur. Even in predominant psychotic patient, a single singer's nodule will occur. A small nodule, even the warts may occur. These are the causes of hoarseness. Again, these hoarseness may appear in case of mitral stenosis. If the mitral stenosis is too big, too big left atrial may cause pressure in the backward. You just think of your mediastinum, your superior mediastinum, inferior mediastinum. Within the inferior mediastinum, there is anterior part, middle part, and posterior part. Whenever in the superior mediastinum, in the middle mediastinum, your increased left atrium is giving you pressure on the left recurrent laryngeal nerve, you will have developed hoarseness. So it may be a cause of, without professional singer, without anything, the hoarseness may happen. And patient having some heart problem, it may be a cause of complications of mitral stenosis. Again, hoarseness may cause due to sudden cry, not professional singers, but sudden cry. Just in the cricket match, and the Dhoni sixer, and we tried, oh, Dhoni, sudden cry, and that may cause crack, that may cause bulky vocal cord, that may cause hemorrhage. This is the cause of hoarseness. Even in the hot, in tremendous hot, you take cold drinks, a very chilled cold drink. It is very indicative of, in case of, it is a very wonderful drug we have, that is Bellis perennis. Bellis perennis, hot and cold, suddenly change. The hoarseness may cause. So our understanding from these holistic point of view, again, these hoarseness may cause in case of CA larynx. In case of CA larynx, it may cause in case of CA larynx. Hoarseness may be the first sign of your cancer, larynx or CA throat. The same thing of redness of eye. It may be due to different type of conjunctivitis disease, but this redness of eye may be the first sign of your any type of autoimmune disorders, maybe of rheumatoid arthritis, maybe of seronegative rheumatoid arthritis, maybe of seronegative spondyloarthropathies, redness of eye, may be the sign of any autoimmune diseases. When you have excluded the cause of allergic cause, excluded the cause of conjunctivitis, chest pain, maybe of cardiac origin, maybe of chest origin, chest pain. It may be due to pneumonitis, maybe due to pleuritis, maybe due to angina pectoris of cardiac origin. Chest pain may be due to TIT syndrome, TEIT is a TIT syndrome, maybe intercostal neuritis. It may be due to hypothyroid. When costal cartilage pain are there, it may be due to AIDS, acquired immunodeficiency syndrome, where intercostal cartilage become painful. This is also cause of chest pain. So this is from clinical medicine point of view. This is the differential diagnosis. But what should be our concept approach to that patient, particularly that is from totality point of view, that is from constitutional point of view, miasmatic dysplasias, but even the chest pain may occur in case of post-herpetic neuralgia. That's why in inspection, any mark, any sign, it is written in inspection, any others. If there is only blackish part, and here are there 2 and 3 in only one part, that may be the sign of mark of your scar mark of herpes. And the herpes post-herpetic neuralgia may last up to 6 months to 1 year. That may be the cause, and you are finding nothing, but chest pain is there, and you are thinking of psychological anything. It's important. Even the chest pain may be of psychological origin. Whenever to attract the concentration of others in very tough situation of your life, you may pretend that the fiend personality you are. You may pretend the chest pain. Even the chest pain may cause due to trough space, due to accumulation of fundic gas. It may occur. So that's why carbopage is very good for that. But never misdiagnose the case of severe chest pain as कुछ भी नहीं है, ये तो पेप्टिक अल्सर, कुछ भी थोड़ा इनो खा लो ठीक हो जाएगा, कार्बोवेज खा लो ठीक हो जाएगा, and patient died. Ultimately, it have of unstable angina. Very important. Small white spot. It may be due to vitiligo, leukoderma, small white spot, but it may be due to pityriasis versicolor. White spot, small white spot. It may be due to pityriasis versicolor, the fungal infection. It may be idiopathic cause. It is called liver spot, but no value. But Bryonia can produce a similar type of round, separate, small white spot. Thuja cannot produce this type of small white spot. Thuja can produce only small spots, but not white. It is something blackish or brownish or all over the body, especially in the covered part. This is the unique differentiation. Small differentiation. Unilateral pedal edema and or pain. Whenever it is with pain, so with pain, the cause of inflammation is there. There is any kind of inflammatory arthritis, the cause. Whenever there is no pain, so think of cardiac origin, think of renal origin, think of heart failures. All these things may cause it, and if this is unilateral, if even of filariasis, if he is coming from Orissa or any sore areas, seasores, so it is a filariasis, Wuchereria bancrofti. Psychosomatic disorders, no hyphen between psycho and somatic. This psychosomatic, so many psychosomatic disorders. Even in the name of all the disease, you are thinking of peptic ulcer, you are thinking of gastric ulcer, you are thinking of very severe type of disease, but patient having nothing, we call it functional. Psychosomatic disorders. So typical psoric patient will treat like this, or otherwise psychotic patient also like this pretending or fiend personality if anyone guided him or her, because psychosis only want to be a slave. He cannot do it himself. Anyone if advise him or her, then he can do it. So this is the call of psychosomatic disease, somatoform disease. I have told already, gynecological disorders, very important gynecological disorders. All the gynecological, from leukorrhea, white discharge to PCOD to even the tubal pregnancy, ectopic pregnancy is a sign of your Cullen sign, typical blue sign of syphilitic predominance. Surgical diseases, clue of the miasmatic dysplasias, fistula, the tubercular background, anal fissure of the predominant syphilitic background. These are the indications, the surgical disease also. So never think surgical disease from surgery point of view. Just think surgical disease from homeopathic point of view. This will give you clue all the surgical disease. So in fact, genomics and genomics and epigenetic symptom, this one. In fact, genomics and epigenetic systems, this is the message, that genomics and epigenetic system mean epigenetic, that is beyond the genes, all the environment, everything, and multivariate based research methods may be one route by which homeopathy can attract much and much greater scientific consideration. This is very important one. So this is our aim. You can see these are the thinkings. It is not of mine. This is the thinking of our Dhawle group's conception, ML Dhawle's group. Previously, I see this is the conception of their Sora form, structure, function. How wonderfully they have made the integration in the form of clinical medicine with the homeopathic concept of Sora, with the concept of syphilis. You can see the function of synovial fluid increase, and with the form, you can see the mentals of the psychosis. And you can see the syphilis, the mental, the aggravation at night, with the function, joint failure, no self-care, and the structure. So how wonderfully they have with their innovative ideas, they have correlated the organon with the clinical medicine. This type of correlation we should make of every disease. Then we can only say that this is the real integration in medicine. So with the condition of clinical medicine, sociology, economy, anthropology, medical geography, clinical ecology, physiognomy, psychoneuroendocrinology, multi-dimensional subject with the homeopathic subject of medicine may make you the integrative medicine. Thank you all, and I'll just say that you just make the integrative thinking with your knowledge of clinical medicine and homeopathic knowledge. The real integration may take part in your mind whenever you will be observing any patient. Thank you.
Thank you, sir.
Thank you a lot, sir, for your nice lecture, and it is very informative for all. I think our students and all audience, or those who are attending this session, it is very informative, and I am very thankful to you, sir, that you have given us to time for this session, and I'm very thankful to our management, our principal, sir, Dr. S.K. Mishra, sir, our commissioner, Dr. M.K. Agrawal, sir, and newly commissioner, Dr. Hajela, sir. And I'm very thankful to our staff, our coordinator, Dr. Babita Srivastava, madam, and the whole team, and my department colleague, Dr. Sanjay Gupta, Dr. Umesh, and all those who are supporting in this program to organize the thing and the session. I'm very thankful to all. Thanks a lot, sir. Many thanks to all. Thank you, sir.
Thank you, sir.
Thank you.
Thanks a lot, sir. Again,
Thank you, sir.
Any questions from audience?
From the audience? Yes.
Aishwarya, can you see some hands raising? Some questions are there from attendees? There are hands raised up, I could see.
Yes,
One
sir.
question is there. It is better to describe homeopathic therapeutics with mode of scientific corrected medicine and prosology. But the topic was in the clinical medicine and integrative medicine. If it is on therapeutic, then I should go through the therapeutic. If in the future, if there is a scope of any therapeutic invention with the disease, I must say I have nothing to say, because we have to observe patient. So there is nothing that we should not disclose anything of therapeutic. It is one. One question is there.
So one more question.
Yeah.
So how can we manage autoimmune disorders with homeopathy? Can we bring down our hyperactive immune system? Because in autoimmune disorders, there is continuous remission and recurrence.
Yeah.
So how can we manage these kind of diseases?
This step already I have mentioned. The question who is asked, he or she may go through my presentation, that exhaustive case taking is very much important, but because something dissatisfaction is there in the evolution of the disease, and why the autoimmunity disease, why the self, we cannot identify that what was the basic pathology behind the autoimmune disorders. So a good kind of case taking with the counseling part and with the constitutional type of treatment, we can treat the autoimmune disorders, I can say. And if the revert pathology is not in the reversible stage, if it is in the irreversible stage, then we may think help of the auxiliary measures like physiotherapy, etc., in case of arthritis like symptoms. But only constitutional treatment with a good time and a good exhaustive case taking only, we have the answer for the autoimmune disorders. And the hyperactive child also, they are talking about hyperactive child. You should not, there is nothing, hyperactive child is something different with the autoimmune activity. The hyperactive child is required a multifactorial with the homeopathy, with the counselors, or as homeopathic as a counselor. So 2 or 3 teams with the hyperactive child, and with the time, the child will improve a lot. So your parents counseling also is very important. So as a doctor, you have to also counsel the parents for hyperactive child. But miasmatic, anti-miasmatic treatment, constitutional treatment can do better to hyperactive or any autoimmune disorders. And we have a lot of case in our OPDs, IPDs. We have seen, I have 25 years in homeopathic practice in homeopathic OPDs. So I can share you more than 100 cases of this type of diseases. We can share with you if time permits in the future.
Again, I am very thank you, sir.
Thank you so much, sir.
The way you are explaining the thing, like examination of patient, heart sound, and the ulcer and RA, these are the very interesting things. These are very interesting topics in our practices, and it is very informative and helpful for our students and our audience also. And again, I am very thankful to you, sir. Any question from anyone else? संजय सर, आप कुछ बोल रहे थे शायद.
Sir,
Just
audio.
unmute.
Yeah, sorry. What I was putting on was ki I thought of ki if we are precisely asking our queries related to the subject, though sir has answered ki what we have been focusing was integrative medicine and integrated this thing, homeopathy, the whole case taking, the way the therapeutics, the way the applied part of the basic fundamental subjects sir has correlated and has focused. When we integrate into our practice while dealing with the patient, definitely it is going to produce result, and it is the requirement of the patient handling. Particularly the question which was raised by Dr. Sinha, I think the answer has been very elaborative and comprehensive. So that is what I was sharing. So I think the time is we are finished in time.
Okay.
Hello.
So,
हाँ
sir,
सर, बोलिए.
available time.
Yeah, we are in time. We have finished in time. I don't think any more questions are there. So I thank you again, sir, on behalf of
Thank you.
GHMC team,
Thank you.
and looks forward ki we will be exchanging and sharing your experience with our team over here. And I thank you very much, sir.
Thank you. Thank you all. Thank you.
Thank you, sir. So we
Thanks a
can
lot,
now end up
Thank
the
you all.
Thank you,
session.
sir. Thank
Okay.
you.
Okay.
Cooperations. Thank you.
So for tomorrow,
Okay,
we will be meeting again on same times. We will discuss about COVID-19 and pregnancy and effect of COVID-19 on female mental health. Tomorrow
Okay.
we will meet again.
Okay.
Thank you, everyone. Thank you, audience. Thank you, sir. Thank
Thank
you,
you.
Homeopathic 360. Thank you, everyone. Thank you.
Thank you.
Okay.
Thanks a lot.